Hi, everybody. Dr. Malcolm Butler here. I am a family physician at Columbia Valley Community Health, and I am also the health officer for Chelan and Douglas counties. And it's been a few months since I did one of these chats with you, and I very much appreciate the time and your attendance here. So I do have some notes up on my screen, so you're going to see my eyes dropping down every now and then to review my notes. So today, I wanted to focus on the variants, the COVID variants. And at the Health District, we have had many questions about the variants. So I'm going to run through some of the most common questions that we're getting. So the first one is, what variant is the biggest threat at the moment? And it's interesting for us because actually COVID is the first time that we have ever had the capacity to even think about variants. So if you think about influenza and other infections like that, we've never really taken the time to sequence things the way we are now. So this is all new and interesting. And there are dozens of variants of the COVID virus that have been identified now. So if you look at a page, you know, there's 30 or 40 of them, there's a lot. And some of them, I mean, if you think about a variant and what happens, the virus is reproducing inside a human, and somewhere during some of that reproduction, a mutation is formed. And some of those mutations, probably most of those mutations, actually make the virus less dangerous, less infectious. And so those don't get passed through. But mutations that make a variant more dangerous do get passed through, and they infect other people, and then they get passed around. So we have different names for these, and we track all these different variants. And variants which very clearly are worrisome, you know, they appear to be more dangerous to them, we call those variants of concern. And then there are variants that we've identified, but we can't really tell if they are more or less dangerous than what we're used to. Those are called variants of interest. And so right now in Washington State, we are tracking 6 variants of concern. Some seem to be more infectious, which means they're stickier, they stick to you easier, they get inside your body easier. And some seem to be to do more damage once they are inside you. So we might say they're more virulent. Once they get inside, they cause more trouble. And the problem is, of course, we can see this sequence, but the virus isn't carrying a little sign that says, hey, guess what? I'm more dangerous. We have to do a lot of research and studying and looking at whole populations of people to try and learn if a specific variant is more dangerous or less dangerous than what we're used to. And so what I want you to take away from that is we actually know a lot more about variants that have been around for a long time. So the first one you may have heard of was, it's now called the Alpha variant because it was sort of the first one we discovered. People have called it the UK variant, and it's been around for 6 months now. So we've had time to study it. We know quite a bit about it. The newer sort of scarier variants that are just coming on the scene, they've only been around for a couple months, so we don't know that much about them yet. So what is uniformly true across the globe is that if nobody gets infected, then no mutations can happen. So as I mentioned before, mutations only happen when the virus is inside a human and is reproducing itself so that it can be transmitted to other people. If nobody gets infected, no variants can happen. And so I think for some of us, gosh, it just feels, why should we even bother trying because these variants are going to come along and be terrible? Well, the reason why is if enough people get vaccinated that we can shut down the pandemic, that nobody can get infected anymore, then no more variants can ever be created. No more mutations would ever happen. So shutting COVID down as far as we can is actually going to decrease and eventually stop new variants being formed. So back to the original question. In Washington State right now, the most common variant is the Alpha variant. That has previously been called the B.1.1.7 or the United Kingdom, the UK variant. But we're trying to get away from those numbers and country names, and now it's just called the Alpha variant. And of the sequences we've looked at right now, more than half of them in Washington state are this alpha variant. And the alpha variant is more transmissible, it's more contagious than the original virus that we experienced all of last year. And that's why it has displaced the original variant, because it does a better job of transmitting itself between people. So the alpha variant, as I said, is the most common. The gamma variant, and this is the Brazilian variant, it used to be called the P1 variant. Right now, over the last few weeks, it looks to be squeezing out the alpha variant. So we see it increasing, and we see the alpha variant decreasing. So what that must mean is that, in fact, it also is more infectious. But we haven't had time to prove that yet with scientific studies. So we're watching it, we're worried about it. It does seem to be a bad actor. Once it gets inside you, it does seem to do more damage. So said differently, a higher percentage of people end up in the hospital pretty darn sick. So it is something for sure that we're looking at. And then finally, the newest variant on the scene is called the Delta variant. It first came out of India, used to be called the India variant. And it is like going crazy in Europe and in the United Kingdom right now. So it has more or less pushed out everything else in the United Kingdom. And so we are quite worried because it really seems to be moving quickly. But again, we haven't had enough time to study it very well because it hasn't been around for very long. But the thing I want you to take away that's really most important about this, and the very best news is that that when we look at studies of vaccinated people, the vaccine seems to be incredibly effective against all of these variants that we have right now. And that may be a little different than what you've heard in the past. You may have heard that some of these viruses are escaping and not the vaccines don't cover them well. And so a little bit of time on that. To do those studies, what we do is we draw blood from a person who has been vaccinated. And we put that blood in a test tube. And then we take one of these new variants and we put it inside the test tube also, and we see whether it gets destroyed by the antibodies in this blood that we drew from the person. And so, in a lab, when we put viruses into test tubes, it looks like, yeah, maybe the antibodies don't protect us very well. But when we actually look at real life experience in Israel, in Europe, in the United States, the vaccines are still very effective, like 90% effective. So the take-home message is you got to get vaccinated to protect yourself from the variants. If enough people don't get vaccinated, we may need to worry about these. And eventually, over time, a variant might be produced, which is a bad actor and can escape the vaccines we have. But today, that's not the case. All right, next question is, how do we differentiate the symptoms between COVID-19 and a variant of COVID-19? And the answer is you don't need to, because the symptoms are exactly the same. All of these viruses cause the same symptoms, and so we just call it COVID-19. So once they get inside your body, and the way they get inside your body may be a little bit different, but once they're in there, the infection that we see or how it looks to have this infection is the same. So the symptoms are the same. The next question is, I got my COVID-19 vaccine, but I'm having COVID-19-like symptoms. Should I get tested? And so what I would say is, if you're having symptoms within 2 days of receiving the vaccine, most likely those symptoms are your immune system revving up, doing the work that the immune system does in creating antibodies. So muscle aches and tiredness and fevers and feeling icky, that's just your immune system revving up, and that's not the virus. So if you're within a couple of days of the vaccine, I don't think you need to get tested. But if in fact you finished your vaccine series more than 2 weeks ago, and you have sort of classic COVID symptoms, then yes, absolutely, you should get vaccinated. So we have seen plenty of cases by this point of vaccine breakthrough. And that's what we call it when somebody has been fully vaccinated and they get COVID-19. The infection broke through the protection of the vaccine. So they're called breakthrough cases. And what we've learned from that is that most of these breakthrough cases happen very shortly after the vaccination. So what we can see now is that immunity continues to grow over time. So we've been saying you're fully vaccinated 2 weeks after your vaccine. It turns out that's probably not right. Your immunity continues to increase for probably 12 weeks or 3 months after vaccination. So most of the breakthrough is happening early when people's immunity hasn't gotten as strong as it will one day become. But the good news is that even the people who do contract COVID-19 after the vaccine, a breakthrough case, they tend to be very mild. And in fact, it looks like when somebody is infected by the virus after they've been vaccinated, they can't even spread that to other people. So in some way, the immune system may not be 100% effective, but it's good enough that you don't get very sick and it's hard for you to transmit it. Now, there are some people after vaccination who have gotten sick enough to be hospitalized, and there are a few people in the state who have actually died after vaccination. When we've looked carefully at that, almost all of them are people who've been what we would say very sick. They have what we call comorbidities. And so typically they are medically frail. And the ones who have actually died, almost all of them have been organ transplant recipients. So maybe they've had a heart transplant or lung transplant, and they're on immunosuppressant medications, which are strong enough that their immune system didn't react to the vaccination, so they didn't develop any protection. Also, you can imagine somebody with a cancer who's being treated with chemotherapy. Those folks, even after vaccination, can get sick, and a few have died in our state. Who is at highest risk for the COVID-19 variants? So that's an easy answer, and the answer is unvaccinated people are at the highest risk of contracting one of the variants. And that's maybe not what the answer you wanted to hear, but it's very clear that if you're unvaccinated, you're at highest risk. Now, a little bit more sophisticated answer. So if you remember early on, back in December, January, when we started vaccinating people, we started vaccinating the eldest part of our population first, and after that, the medically frail or people who are most likely to have a really hard time with a COVID vaccination. I'm sorry, with a COVID infection. And so when you look at the people in the population right now who are not vaccinated, they tend to be kids under the age of 12 because we don't have a vaccine for them yet. And they tend to be people under the age of about 30, so young adults. Largely, I think, because they say, I already had COVID, I don't want to get vaccinated, don't need to get vaccinated, or I just don't believe this is any kind of a problem for me, and I'm not going to get vaccinated. So now what we're seeing is these variants appear to be attacking young people more than old people. That is, young adults seem to be attacked more than old people. Probably that's because young adults there are more young adults unvaccinated than there are elderly folks unvaccinated. So it may just be a mathematical problem, or it may be true. It may in fact be true that these variants are attacking younger people more than older people. So we're doing more research on that, and what I can say right now, I can't tell you whether males or females or Hispanics or Anglos or Blacks or Asians, I can't say any of that. What I can say for sure is unvaccinated people are at much, much higher risk of the variants. All right, next question. Which COVID-19 variant is in our area? And by that, I'm going to take you to mean Chelan and Douglas counties. So that answer is a little bit tricky. But when I look at the variants that have been identified in Chelan and Douglas counties up through 2 or 3 weeks ago, the only two variants that have been identified are the Alpha variant, so that's the UK variant, and the Epsilon variant, that's the California variant. So those are the only two. So we haven't seen any Delta or any Gamma. And we are not randomly testing people and sequencing those tests. So what I can tell you is, of the specimens that have been sequenced, have been looked at carefully so we can identify them to be variants, the only two variants we have seen are the alpha and the epsilon. But I cannot tell you that those are the only two that are here. There are probably others here yet, we just haven't found them yet. Okay. It looks like that's the last question. So we very much appreciate you getting in touch with us. We enjoy providing as much information as we can. If you have other questions that you would like answered, please get in touch with the Chelan-Douglas Health District. If you are not already, please get vaccinated, and I appreciate your time today. Thank you.